In this video, we'll be discussing an important medication frequently encountered in both medical and psychiatric nursing practice, which is gabapentin. This versatile drug is widely used for several conditions, but understanding its mechanism and safety considerations is crucial for effective nursing care. Now let's go over its indications, action, adverse reactions, contraindications, nursing responsibilities, and patient education. Starting with indications. Gabapentin is prescribed for various conditions including neuropathic pain, seizure disorders, fibromyalgia, anxiety disorders, and migraine prophylaxis. Let's take a moment to go over each of these conditions and how they are treated. Neuropathic pain, commonly used for conditions like diabetic neuropathy and postherpetic neuralgia. Seizure disorders, used as an adjunct therapy for partial seizures in adults and children. Fibromyalgia, helps alleviate chronic pain and improve sleep quality. Anxiety disorders, off-label use to reduce anxiety symptoms. Migraine prophylaxis, occasionally prescribed to prevent migraines. Alright, moving along, let's now learn about the action of gabapentin and how it works. Gabapentin belongs to the class of anticonvulsants, and it works by binding to calcium channels in the central nervous system, modulating neurotransmitter release and reducing nerve excitability. Note that despite its structure, it does not act on GABA receptors directly. Adverse reactions. Gabapentin is generally well tolerated, but potential side effects include drowsiness and dizziness, peripheral edema, fatigue and weakness, mood changes, and ataxia and tremors. Drowsiness and dizziness. These are the most common side effects, especially at the start of therapy. Peripheral edema. Swelling in the hands or feet may occur, particularly in older adults. Fatigue and weakness. Patients may report feeling overly tired. Mood changes. Rarely, gabapentin can cause depression, agitation, or suicidal thoughts. Ataxia and tremors. Uncoordinated movements or shaking may develop in some patients. Contraindications. Gabapentin is not suitable for everyone. Gabapentin is contraindicated in the following cases. Hypersensitivity to gabapentin. Always assess for drug allergies. Severe renal impairment. Dosage adjustments are required as gabapentin is excreted through the kidneys. Caution in substance use. Disorders. Gabapentin has potential for misuse or dependence in some populations. Nursing considerations. Remember that as nurses, we play a critical role in ensuring the safe administration of medication. Here are some nursing considerations. When administering gabapentin, nurses should monitor for CNS depression, adjust dosage in renal impairment, assess for suicidal ideation, educate about sedative effects, gradual discontinuation, and prevent potential misuse. Let's go over these in more detail, and these are very important considerations. Monitor for CNS depression. Assess for excessive sedation, drowsiness, or confusion, especially in elderly patients. Adjust dosage in renal impairment. Ensure the dosage is appropriate based on the patient's kidney function. Assess for suicidal ideation, particularly during the initial weeks of therapy or after dose changes. Educate about sedative effects. Advise patients not to drive or operate heavy machinery until they know how the drug affects them. Gradual discontinuation. Gabapentin should never be stopped abruptly as it may lead to withdrawal symptoms or seizure risk. Prevent potential misuse. Monitor for signs of abuse, especially in patients with a history of substance use. Patient education. Finally, let's discuss what we need to teach our patients. Effective patient education ensures safe and successful treatment with gabapentin. Purpose of the medication. Explain how gabapentin helps manage nerve pain or control seizures. Consistency is key. Encourage patients to take gabapentin at the same time every day to maintain steady blood levels. Avoid alcohol and CNS depressants. Combining these with gabapentin can increase sedation and respiratory depression risk. Monitor side effects. Teach patients to report persistent dizziness, swelling, or mood changes. Gradual dose adjustments. Stress the importance of following the prescribed tapering schedule if discontinuing the medication. Storage. Keep gabapentin out of reach of children and store it at room temperature. So there you have it. Gabapentin is a widely used medication with significant benefits for managing neuropathic pain, seizures, and other conditions. However, understanding its potential side effects and ensuring proper patient education are vital for nursing practice. All right, well, that ends this nursing review. If you found this video useful, leave a like and a comment so we can continue to make more videos like this. See you again!